Hello everyone, thank you very much for watching this video. My name is Luke Elijah. I'm here at the Ensoul clinic and seated beside me is Dr. Kenneth Thean. Thank you very much Dr. Thean for agreeing to come onto my talk show and sharing with us your expertise and knowledge.
Hi Luke, good morning to you.
Right,
Hello,
Dr.
everybody.
Thean, you are the laser expert, you're the laser guy. Could you tell us a bit about your background and your philosophy?
Well, I started doing clinical medicine and I liked looking after patients. But what happened is that clinical medicine is just one aspect of all of medicine. Making people look good and feel good became an important part of my practice because I started doing some aesthetic medicine and it grew and grew and grew because I had interest in it. I was doing a good job and patients liked it. So I slowly moved from clinical medicine to more and more aesthetic medicine to right now I'm only doing aesthetic medicine, making people look and feel good.
Wow, right. And you have many years of experience. You're working for the National Skin Center and you're one of the pioneers there, right? And you've won many accolades and recognitions. And right now in this clinic, you own 23 energy apparatus and devices. Why so many?
Okay, I have 23 medical aesthetic devices because I find I can do a lot better job if I have full range of machines, a lot of tools to work with every different skin kind. Now look at it. Everybody's got different skin. So I can look at a patient and say, you need this, and you need this, and you need this for optimal results and get optimal results. Now think about it this way. You've got the epidermis, you've got the dermis, you've got the smas, which is below the dermis, and you've got the muscles. Now if I only treat one area, I'm not getting the results that I can get by treating all four layers. All four layers will need different machines, different techniques, different powers, and with this range I can achieve a lot better than if I only had one or two machines.
That's actually really logical and sensible, the way you describe and explain it.
Thanks.
Alright, now what can you do for someone with really severe acne scars, like the really pock-marked face and really bad texture, and it affects their self-esteem? What can you do for them?
Okay, so while I do a lot of pigmentation, and because of the sun in Singapore, we have so much pigmentation, I really like to do acne scars because it makes the acne scar sufferer much more confident, much happy, because instead of having rough pockmarked skin, they have much smoother skin. I use a combination approach for acne skin because acne skin scars have got two components, a colored component, which is brown or red stains on the face, and depressed or raised scars, which need a different kind of machine to raise the level of the scars to be smooth. So for pigmentation, I'll use lasers to remove as much of the pigmentation as possible to make the skin as even colored as possible. And for the depressed scars, I have 3 different energy device machines that work very well synergistically to bring up the scars. So I use ablative lasers, I use ablative radiofrequency, and I use ablative radiofrequency needles, all to bring up the level of the scars and raise it.
Wow, that sounds really technical. Could you share with us what's the latest technology and medical advancements for skin aesthetics?
Well, what we have found recently is instead of using one machine and just using that machine, a combination approach works better. Now think of a gym approach. If you were to just run for fitness and you run for 2 hours every day, you're going to get fit, sure, but the chance of getting injury and the chance of just developing your leg muscles is much higher than if you were to say go to the gym, do 20 minutes of running, 20 minutes of weights, 20 minutes of machines, maybe 20 minutes of Pilates, then you get a full range of exercises that would treat different parts of your body and at the same time give you much better results. So the same, if I were to use many devices at the same time, but a little bit of each, I get the synergistic effect of all the machines working together, and your body responds better than just using one machine over and over again. I go overseas both to attend conferences and to give talks, and we learn from all the overseas experts on how to use the machines, and we get slow, small, incremental improvements in techniques that together over a long period of time show better and better results. And that's how we improve in medicine.
I really like the analogy that you used, and this technique definitely synergistically produces really good results, as you can see from your happy patients that keep returning. Right, doctor, could you tell the audience how old you are?
Okay, this year I've passed my 61st birthday, so I'm 61 years old.
What, 61? I can't believe it. Not a single pore or wrinkle. When I'm 61, I want to look like you.
You will, just come to me.
Yeah, right, doctor, where can the audience go to find out more or to fix an appointment and consultation with you?
Okay, so you can visit my website www.ensoulclinic.com. I'm in International Building in Singapore, Orchard Road.
I'll be placing all his particulars and details below in the description feed. To click on it and make yourself an appointment, do yourself a favor. He's the best skin aesthetic doctor here in Singapore. Right, thank you, doctor. We hope to have you again in a future video to talk about a different topic.
Thanks, Luke. Thanks, everybody.